I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe Esposito here. I am so glad you joined us today because what we're talking about today is cold and flu. Cold and flu season, what does it look like when COVID is thrown into the mix? And a lot of good news out there, actually. Looks like what we're doing is working. The Southern Hemisphere had winter already through cold and flu season. Very few cases of flu reported, which is really exciting. But keep doing what we're doing. Okay, we covered all that in the first half of the show. I'm not going to revisit that. If you want to listen to the show, this is on the website, drjoe.com. Also, if you're not following us on Facebook and Instagram, shame on you. You need to be. We live stream all our shows. We live stream this show, as a matter of fact. I do a Sunday night show from 7 to 9 on WSB Radio in Atlanta, and that's a live show. We do call-ins there as well. And so we live stream those as well on Facebook. So make sure you're following us at Dr. Joe Esposito, Facebook, Instagram, and YouTube. And that's your admission, by the way. I get a lot more people following when I say this. It's kind of cool. We give you all these shows for free. The website, tons of information for free. I'm going to give you a cover charge. Cover charge is follow us on Facebook, Instagram, and YouTube at Dr. Joe Esposito. It's a pretty simple thing to do. And I'll give you all this stuff for free. I'll give it to you for free anyway. But that's going to be your homework, okay? So let's jump in right now on the supplements that I take every day. You probably should too. So research supports using vitamin C during cold and flu season to reduce the duration of symptoms. Higher doses you take, the better results during a cold to a point. You have something called bowel tolerance. You can only take so much vitamin C until you get diarrhea. So if you're taking mega doses of vitamin C, if you start getting loose stools, cut back to 80% of that. So what I tell people is build it up a little bit at a time. Take a recommended dose, then double the dose, then double the dose. You will get loose stools. Back it off, okay? And you don't want to do this for long term, and especially different types of vitamin C. So as a general rule, I don't recommend high doses of vitamin C every day. Liposomal vitamin C is probably the safest form to take if you're going to take mega doses. I don't recommend long-term chronic doses of vitamin C supplements because it can cause nutritional imbalances. So mega doses of anything, short-term, okay, long-term can throw off the balance. So for example, if you take large doses of vitamin C, and many times they call that ascorbic acid, which I'm not a fan of, by the way, on a regular basis, it lowers your level of copper. So if you already have a deficiency in copper and you take high doses of vitamin C, that can weaken your immune system, exact opposite of what you're trying to do. So temporary mega doses of liposomal vitamin C to combat a case of the cold or flu might be helpful, but giving it on a daily basis in mega doses is not a good idea. In Dr. Joe's Essential Source, I told you I was going to visit this a lot today, we have 100% of the recommended dosage of vitamin C. So if you're eating a good diet, like citrus fruits, bell peppers, broccoli, Brussels sprouts, butternut squash, papaya, sweet potatoes, fruits and vegetables basically, are going to give you lots of vitamin C. Then you're taking Essential Source. You should be getting a lot of vitamin C. If you do get sick, you can mega dose on liposomal, but only for about 3 or 4 days. Then I recommend cutting that out. So health occurs, if you don't know why this all works, I'll give you a little science class here. So hang on, I'm gonna do this quickly. I don't want to bore you here. But you have to have an interchange of something called electrons in your cell. I'm going to take you back to grammar school chemistry here. If you have bad electron flow or interchange, the body gets sick. So electrons are the things the body needs, and the cell can die. Oxidation caused by free radicals causes the loss of electrons. So free radicals are like Pac-Man. Remember Pac-Man? Waka, 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 waka. They're eating through things. So Pac-Man is free radicals. So along comes electrons, free antioxidants that kind of stuff up Miss Pac-Man's mouth and she can't eat anymore. And they stop the damage from happening. So free radicals are the things that shut off Pac-Man from doing the damage. So antioxidants counter the disease process caused by oxidation. Remember, oxidation, breakdown of things, waka waka, loss of electrons, by supplying extra electrons. Vitamin C is a major antioxidant and perhaps the most important electron donor there is. Now, another important electron donor is glutathione. So I take glutathione supplements every day because as you get older, you produce more free radicals, you have less antioxidants. So glutathione really helps the liver heal, and the liver is the main filter in the body. So I take glutathione every single day. You probably should too. It's on the website, drjoe.com. So the supplements I'm talking about are all available on the website, drjoe.com. You can order them. We'll ship them to you. Joe's in charge of shipping, so he'll get them out to you. Better yet, come by and pick them up. If you're in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. And we'd love to have you come by and say hi. And it's going to save you shipping. And this way, Joe, I don't have to pay Joe as much. So I'm trying to cut Joe's salary here. No, Joe gets paid no matter what. But I want to see what we can do to save costs. We're going to have to raise our prices on the supplements, folks. Unfortunately, we haven't raised them in years. And probably soon we're going to have to raise them just a little bit. So now's a good time to stock up. So I'm giving you fair warning. Don't say I didn't tell you. Our suppliers' prices are going up. We haven't raised them, 10, 15 years. So we're going to have to do it soon. So, but the Essential Source has the Super Greens, has the vitamin C in it. Super Greens is also a great source of antioxidants. And then the glutathione is another great source of antioxidants. So vitamin C is remarkably safe and effective for treating viral infections. We don't have a drug to treat viral infections necessarily, but we can get your immune system working better. So high dose of vitamin C neutralize the free radicals. They kill the viruses. It strengthens your immune system. So taking it routinely is a good idea. That's why another reason I recommend Essential Source every day. It's a great source of vitamin C. So vitamin C, good. Short-term megadose is fine. I wouldn't recommend it long-term. It affects copper absorption, and copper helps the immune system, and so now you're being counterproductive. Vitamin D. If I had to give you one supplement that you should take every single day, especially from, when the sun starts to change, when the hot days of summer are gone until the hot days of summer return, vitamin D. Low vitamin D also increases your risk of contracting cold and flu. There was a study that was out a couple of weeks ago. I talked about it on this show and the show I do on Sunday nights on WSB Radio, 7 to 9 live in Atlanta, Eastern Standard Time. You can catch it at WSBradio.com if you don't have a radio. And I answer questions then. I take questions from my listeners because that's a live show. We have callers there. We don't have that capabilities here. Study came out, normal vitamin D levels, 50% reduction in the risk of getting COVID. One day, one report, that was all I heard. So that's why you listen to this show, because I give you all that information you're not going to get anywhere else. Vitamin D produces in your skin is the sun exposure. It's a steroid hormone, powerful antimicrobial activity. Wipes off the bad guys. Capable of fighting bacteria, viruses, and fungus. Not a lot of drugs do that. The evidence is clear. Low vitamin D levels, the higher the risk of developing cold and flu. And now the studies are kind of jumping on that with COVID as well. So decrease your vitamin D, you increase your risk of comorbidities. The new word everyone's learning since COVID came out. Comorbidities, obesity, diabetes, high blood pressure, heart disease. Low vitamin D is associated, not causing, but associated with all of these other comorbidities. And if you're overweight, you need to take more vitamin D because vitamin D is fat soluble. What that means, it gets absorbed and utilized more efficiently in fat. If you're fat, I used to be fat. I can say the F word. If you're fat, you need to take more vitamin D. But the best thing to do is get your vitamin D levels checked because too much vitamin D is dangerous too. I take 5,000 international units of vitamin D. Okay, I'm 6 foot, about 175 pounds. So I take 5 drops of Dr. Joe's vitamin D every single day. I had my vitamin D checked a couple of weeks ago. I was at 58 nanograms per milliliter. 60 is ideal. So I was right where I needed to be. But I'm going to bump it up a little bit. I'm now taking 8 to 10 drops a day. Now, also vitamin D, we get this question a lot with testosterone. You need vitamin D to build testosterone. So if you're low in testosterone, if you're low in free testosterone, you need to make sure your vitamin D levels are up there too, gentlemen and ladies. So not a bad thing to do. Bump it up a little bit. And we can test you with vitamin D in our offices, and we can get that along with other nutrients to see if there's any deficiencies, and then we can customize a plan for you. But generally speaking, 5 to 8 drops of vitamin D every single day. Can't imagine a day without it. Researchers believe vitamin D offers protection by increasing antimicrobial peptides in the lungs. Peptides are like proteins. And that may be one of the reasons why cold and flu are most common in the winter when sunlight exposure, therefore vitamin D production, is at its lowest. So that's been a theory that's been around for a long time. We get more sick in the winter because we have lower vitamin D. So take a supplement. Ideally is get out in the sun, but you can't get the vitamin D in the winter because the UVB rays hitting your skin aren't strong enough to interact with cholesterol to create the vitamin D. So what do? Take vitamin D supplements. See how easy this is? It's the least expensive insurance policy you'll ever buy. Now, our vitamin D also has vitamin K2 in it, and vitamin K2 we find works synergistically with vitamin D to make it work even better. When I design these things for you folks, I'm thinking of the least expensive, most effective thing we can do that's going to cover most health issues. And that's why on our website we have very, very popular supplements because people love them because they get great results with them in most cases. I can't guarantee anything. Everybody's different. But we have male hormone balancing. We have female hormone balancing. We have estrogen regulators. We have vitamin D. We have B vitamins. B vitamins, folks, absolutely positively. I don't know if I have time to cover it. You have to have normal B vitamins in order to keep your immune system strong. I take Dr. Joe's B complex every day, and we have B vitamins in the essential source. The good news about B vitamins is you're probably not going to overdose on them. They're water soluble. So if you take a lot, you'll pee it out, it turns yellow. Hey, that's great. I did a good job. I took enough B vitamins. My body's utilizing everything that it needs. But B vitamins also very important. So vitamin D, vitamin C, which you can get from the essential source, the glutathione, which is a separate supplement. See how we're building a protocol for you? Dr. Joe's seasonal tonic. If I do get sick, it's ginger, horseradish, cayenne pepper, onion, and garlic pureed in apple cider vinegar. I'm not claiming a cure. I'm claiming what I do because all those things are antibiotic, antiviral, and antifungal. So it's things that I do to keep myself healthy. No guarantees, no promises. I'm not making any, swears by this. Seasonal tonic, I take it every day in the winter. Echinacea, pau d'arco, and olive leaf extract stimulate my immune system. Tastes pretty cool too. So has a touch of alcohol in it. It's funny, I had a child one time, a 4-year-old, drank a whole bottle of it. And I thought the kid was going to get drunk. Never did. It was fine. But it's just so little alcohol in there. But I thought, and it has a kind of a tingly taste to it. And I thought, why would a child drink a whole bottle of this? But they did. Kids, what are you going to do? So we're talking about vitamin D now. I digressed a little bit there. According to International Research Team, one person would be spared from influenza for every 33 that take a vitamin D supplement, regardless of everything else, just a vitamin D supplement. 1 in 33 would be spared the flu. 1 in 40 who received a flu vaccine, it can prevent the flu. According to researchers, not me. So among those who with severe vitamin D deficiencies, 1 in 4 people taking vitamin D supplement would be protected from the flu. So it's pretty simple. Okay, now I'm not saying don't take a vaccine, no, don't not take the vaccine, but this researcher, quoting them, 1 in 33 people would be spared the flu if they take vitamin D, 1 in 40 would be spared the flu if they take a vaccine. For optimal protection, get tested. Again, we want to get it right around 60 to 80 nanograms per milliliter. If it's not an option where you live, take the oral vitamin D supplements, please, folks. Unless you're living along the equator, South Florida, chances are you're going to need it. And we have the vitamin D3 with K2, which makes it work even better still. So if you feel getting sickness coming on, if you're coming down with the cold or flu, you can take a mega dose of vitamin D of 50,000 international units a day for 3 days. Again, these are just little tricks you can do. No guarantees, no promises, but if I feel a little sick, I'll take 50,000 international units. Again, that's 50 drops of Dr. Joe's vitamin D with K3. It's a lot because it's 1,000 units per drop. So it's a lot, but you do it for 3 days. There's still a possibility that vitamin D doesn't work, even with mega doses. If you've never been exposed to an antigen, if you've never been exposed to the virus or the germ, ultimately you might get sick because your body doesn't know what to do with it. You can also take 4 grams of liposomal vitamin C every hour until you feel better. That's a lot. You might get diarrhea from it, so just be careful. Zinc. Got to talk about zinc. Zinc is one of my favorite supplements. A third nutrient deficiency, cold and flu season, zinc. It can reduce the duration and severity of cold, especially at the first signs of infection. If your body has no way to store zinc, which it doesn't, so it depends on a supply every day. So good sources of zinc, aside from supplements, what might they be? Beans, chickpeas, if you like hummus, that's great. Lentils, tofu, walnuts, cashews, quinoa. Now you can get zinc from meat. You can get zinc from oysters, which please don't ever eat. My God, oysters are like shellfish are the worst of the worst. When Moses wrote Leviticus, here's a distraction. When Moses wrote Leviticus, way back when, Leviticus is a part of the Old Testament, a part of the Bible, and I think it's part of the Quran. It's part of the Torah. And Moses talks about what to eat in Leviticus and how to not personal hygiene. And he said, don't eat shellfish. Because even then, when the water was clean, shellfish are filters. They live on the bottom. They filter out all the heavy metals, the viruses, the toxins. When you eat the shellfish, you're eating concentrated toxins. I can't imagine why you would do that. If any animal product, don't eat the shellfish. My gosh, that's the worst of the worst. Fish should have fins and scales and swim. So that would mean bottom dwellers? No, not a good idea. Sharks don't have scales. Not a good idea. Eel don't have fins. So that's why when Moses laid it out, he laid out guidelines on what to eat. Those held true, even to today. So you can get zinc from eating oysters, but you can also get a lot of other things. So you can get it from eating lamb. You can get it from eating other meats. I wouldn't recommend doing that. The good news is Essential Source has 100% of the daily dose of zinc in it. So if you're eating a good diet, which is going to be beans and chickpeas and tofu and walnuts and fruits and vegetables and nuts and seeds, and you're taking Essential Source, you should be getting plenty of zinc. Now, you can get zinc lozenges, and you can suck on a zinc lozenge because what the zinc does, the zinc binds to the virus and prevents the virus from reproducing. Now, hydroxychloroquine, you may have heard about that. The way that works is it gets into the cells and it changes the cell permeability to allow zinc into the cell where the virus is living to bind to the virus to protect it from reproducing, prevent it from reproducing. So zinc is really important. Zinc increases production of white blood cell, which can fight infections. It also helps your immune system release antibodies. If your body has inadequate zinc stores, and again, it doesn't store it very well, you will experience increased susceptibility to certain infections as white blood cells can't function without zinc. Don't take too much zinc. Too much zinc is toxic. So too much vitamin D is toxic. Too much vitamin C is not good. So again, you got to hit that Goldilocks zone. Now, I'm throwing a lot of stuff out at you today. If you want to listen to the show again, and I think you should, go to our website, drjoe.com. You can type in COVID. I guess Joe will list it under COVID, somewhere like that. Yeah. Type in a search bar COVID. You'll be able to listen to this show. Again, I'm not making promises. I'm not saying I have a guarantee for curing anything. These are the things that I do based on my 40 years of research. So zinc affects multiple aspects of your immune system, cytokine production, gene regulation, lymphocytes, white blood cells, does a lot. So zinc lozenges may cut the duration of cold and flu. As with other nutrients, it's best to make sure you're getting enough zinc in your diet year-round. Of course, eating a good plant-based diet, you're going to get plenty of zinc. However, if cold strikes, you can use zinc lozenges. There was a meta-analysis done of 7 randomized trials. So they took 7 randomized trials and said, what was the results of all these things combined? And they concluded that zinc lozenges shorten the duration of the cold by 33% on average. Zinc acetate might be slightly better than zinc gluconate. Zinc sulfate, not a good idea. So again, acetate or gluconate is the best choices. Sulfate's not a good idea. And so you can suck on zinc lozenges, which I do if I start feeling like I get a sore throat. And I carry them. I have a bag that I carry all my radio and television things in. I carry my makeup in there. I carry my headsets in there. I carry my tripods and everything, my chat chargers. And I actually have zinc lozenges in there. So if I ever get a little under the weather, I'll just pop a zinc lozenge. And so that's a pretty safe thing to do. Again, short term. You don't want to suck on them every day. That's too much, and that can have an adverse effect. Beta-glucans. These are polysaccharides that you find things like in mushrooms, shiitake, maitake, oyster mushrooms, and nutritional yeast. Beta-glucans enhance something called natural killer cells. So this is why you're seeing a lot of mushroom supplements kind of coming out now. We may actually come out with one ourselves because of the beta-glucan. Now, there's also beta-glucan in oatmeal, not the same kind. But nutritional yeast, I like it. It does have a lot of glutamic acid in it. So if you're susceptible to headaches and you do nutritional yeast, the glutamic acid is like monosodium glutamate. It might trigger a headache. So use nutritional yeast. I recommend you use it all the time. If you get headaches from it, don't use it. Mushrooms are great, though. I have a great mushroom gravy recipe in my book, Eating Right for the Health of It. I have over 200 recipes in that book. Prescription for Extreme Health is another book that I wrote. It's a guideline. It's like an owner's manual for your body. I know that's been used by another author before, but it really tells you how to deal with your body. And so both those books are on the website, drjoe.com. We also have them available. We can send it to you as an attachment, too, so you don't have to buy the physical book. But beta-glucan, unbelievable stuff. One study, Associate Professor of Medicine and Biomedical Data at Stanford University, The first biomarker that shows up on a whole shows susceptibility to influenza. And what they're finding is that the beta-glucans can fight those markers. On whole, those immune cells consisted of 10 to 13% natural killer cells. If you have 10 to 13% of natural killer cells in your body, you don't succumb to the flu, where those who had natural killer cells less than 10% wound up sick. Again, it's not a guarantee, it's not a promise, but the beta-glucan can help as well. So you see how there's so many things you could do. Proactively, you have to cut out sugar. Now, when I say sugar, breads, cookies, cakes, donuts, pastas, you have to stop that. Not cut it out, cut it back, cut it out. And the problem is during cold and flu season is what do we have? We have parties, we have Halloween. Here's my prediction, I'm right every year. Right after Halloween, people are going to start getting cold and flu. Watch it. It happens every year. They start to get better. Thanksgiving comes along. Week or two after Thanksgiving, people are sick again. Christmas comes along. Week or two after Christmas, people are sick again. New Year's comes along. And then finally, we're getting into the cold and flu season, wrapping it up as spring comes out. I promise you, it happens every year. I've given this lecture every year for decades. You will see people start to get sick when they start dumping all the sugar into their body. So here's my secret. Get the bad food out of the house. If you have breads, cookies, cakes, donuts, pastas in the house, you're going to eat them. Everyone does. I do. I'm vegan, so I have to be vegan, of course. But you got to get them out of the house. If you don't, chances are you're going to get sick. So if it's not there, you're not going to be tempted. You want to get a lot of water in the body. You want to make sure you're taking supplements. My supplement protocol, once again, Super Greens, an essential source, vitamin D, glutathione, I eat mushrooms on a regular basis, beta-glucan. Make sure you're getting all these things into your body. B vitamins every single day. I take omega-3 fatty acids as well to bring down inflammation in the body. So there's other supplements. I've customized a plan for me, and we'd be more than happy to customize a plan for you. But I threw a lot out at you today. Again, this show's on the website, drjoe.com. If you have a health issue, neck pain, back pain, shoulder pain, arthritis, we have a one-stop shop for wellness. We start people out with chiropractic care, most effective, least expensive treatment for pain. We do a consultation. If you're a chiropractic patient, most people are, we move them to the chiropractic division. If you have severe arthritis, we may add to that PRP. PRP, platelet-rich plasma. We take the platelets out of your blood, spin it down in a centrifuge, and put them back into the body. Amazing things are happening with this research. And I promise you, this is going to be the next big thing in healthcare. It has to be. I'm going to make sure it is. So everything I've ever predicted, from margarine being the number one cause of heart disease to now this, staking my reputation on it. So come see us if you'd like to make an appointment. If you have arthritis, if you have degeneration, the knees, the shoulders, the spine, PRP might be the way you want to go. Sometimes we need to do medication. Sometimes we need to do injections to calm down an inflamed joint, and then we can do the PRP. Then we can do the chiropractic. So it's not just one or the other. You're getting everything in one clinic. And so if you want to make an appointment, you go to our website, drjoe.com, and you can book right online. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We only offer the medical services in our Marietta office. But again, that's not a lot of visits, maybe 1 or 2 visits, maybe 3. Normally, we charge $375 for that first visit. That's an exam, x-rays, consultation, first adjustment, again, chiropractically, and then going over the x-rays and the nutrition evaluation. We've reduced that down to $149. Most of you are going to need more treatment than just 1 or 2 visits. So we do accept insurance for future treatments. We accept Medicare. We're in a few clinics in the world, I think, that still accept Medicare. We are very good at working with car accidents. If you've ever been in a car accident, I'm on my knees begging with you, please come see us as quickly as possible. Because what we're seeing now, the courts are way backed up with lawsuits. So the insurance companies, and I don't know if this is why they're doing it, I'm projecting here, is they're saying if you don't get treatment right away, and even in Florida they do this, if you don't get treatment in the first 2 weeks, the insurance doesn't cover it. So you might want to consider getting to us right away. Anyone in a car, including children, need to be seen right away. Because car accidents, if the car was damaged, you were damaged, and you may have permanent damage from that for the rest of your life if we don't get to the cause. Not getting you scared, I'm just telling you the facts. So again, I'm Dr. Joe Esposito, the website drjoe.com. If you want to make an appointment, you can do it right online. You can call us at 844-44-DR-JOE. We're more than happy to set you up an appointment. I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.